Heather Wells, how are you?
I'm very well, thank you, Stephen.
I have been looking forward to this for years. Because we've spoken many times on the phone,
Yes.
In regards to recruitment, in regards to, I guess you say, families, life,
Yes,
real
yeah,
life.
Absolutely.
And, you know, when my oldest was born, I knew about it. My second was born, I knew about it. We've spoken about Hatfield and all that type of stuff.
Yeah.
So I've been looking forward to having you officially speak to me in a format like this for BioTalent Social, in regards to Heather Wells and everything of what those two words together mean. So thank you for coming to speak to us. Let's start off with, I guess, who is Heather? Give us a whirlwind of who you are.
Gosh. Wow. Genetically, I'm 76.6% Londoner. And I'm really quite proud of that. It's really weird, but it's true.
What part of London?
East London.
Okay.
My grandparents were born in Poplar.
Okay.
Both of them one of 12 siblings, or 13, I think some were lost young. So it's fascinating. And on some of these DNA websites, I've got thousands of relatives I don't know about, I've never met. So I must explore. So I grew up in Twickenham. Nothing remarkable there. When I was 10, my father's work took us down to Worthing in Sussex. I got down there, I was given a clarinet and I started to play. Loved it. And I really started to come alive much more from that age on. I did classical guitar as well, which is a bit of a challenge, but there you go. And my parents never took any interest in my schooling. You send them to school and that's it, forget about it. They'll do the rest. Incorrect. My teachers did try and help me. One of my teachers read me very well, my history teacher. Heather, you're not going to get any GCSEs, any O-levels. That's it. And she knew full well that that would motivate me. And that's been my life ever since. I think enthusiasm and motivation and self-motivation, if you like. So I had a place at Liverpool Medical School. Failed that. Boys were far more exciting than studying. Lesson learnt.
Heather.
Absolutely, well. And so I looked around. I tried to do BSc SRN, as it would have been in those days. No, you're too bright, go away and be a doctor. Darn, I'm stuck in the middle of the two. So, well, what can I do instead? So I found a course at Hatfield Polytechnic, as it was then, which was applied biology, but they had a lot of support from many of the big pharma companies who are based around Hatfield. So I went and did that. And as I was finishing, we had a talk from a gentleman who'd done a master's degree in biological computation afterwards. I thought, oh, that sounds good. So I went up to York, did my master's degree. As I finished there, I applied for all sorts of jobs, didn't quite know what I wanted to do. And as always, I was somehow led in the right direction. And I ended up at Bayer, and I did 11 and a half years there. To start with, I did about, I guess, 3 years as a data manager. In those days, we had no SOPs, there wasn't anything. But my brain works like that. So before I went on my first Christmas break, which was I joined in September, I wrote some basic, step one, step two, this is what you do, this is what I've been doing and how I do it. Because my boss had always said to me, nobody in a company is indispensable. Always make sure somebody else can pick up your work, hence the SOP and what have you. As it happened, I went down with appendicitis and had my appendix out and had about 5 weeks off at that point. No problem, no grief. She picked up my notes, the team picked up my notes and they carried on. So the joke at Bayer was that every time I had a child, they shoved me into a new role because they were doing a reorganisation. So the first time I was put into a quality role for biometrics, data management and biometrics. And it was a bit like, I don't want to be there, but I just got on with it and realised actually somebody knew me better than I did. Thoroughly enjoyed it, loved it. And then I moved into the second child. I moved into the general quality team, doing site audit, lab audits, you name it. If it moves, I'll audit it. And there are times when people have asked me to do audits and I've gone, you want me to audit what? Okay, sit down, logic. What are the standards I need to audit to? What do I need these people to do? And then where am I going to see the evidence of that?
Okay. I'm going to unpick this a little bit more. So let's rewind and unpick the start of your interest in sciences, because I know when I was studying science GCSE, and probably for the many hundreds, thousands, millions of people out there who are studying GCSE science, they're probably taught that the career path would be either a science teacher or a scientist, as opposed to somebody who is a quality assurance professional or a medical affairs professional or a validation professional. So at what stage did you think, yes, I want to pursue a career in life sciences properly?
Well, we didn't actually do any careers advice until I got to just before my A-levels. It just wasn't done at all. I didn't know what I wanted to be, not a clue. Just biology was easy. It went well with chemistry and physics, so I got on, I studied those. I had no idea where it was going to lead. And then I went to university doing my favourite subject. At that stage, I'd been thinking medicine, but why? I guess I've always liked helping people. So when I was 11 and we moved, I joined St John Ambulance. So I'd done quite a lot of first aid work and I liked that. So I guess that's why I went down that medicine route, and then I couldn't. So I ended up doing applied biology.
You get into industry. Your first job was?
Data management.
And I mean, give us some ideas as the type of job titles that you've had to your seniority now.
Right. So yes, I started as what they called a clinical data analyst. Because nobody liked the word manager at that time, because you managed people. Nobody quite saw it that you managed data. So a clinical data analyst. Within 3 years, I was what do they call me? I can't remember. I think they called me a manager of clinical data analysts or clinical data management. And I had a team of originally 3 people that grew to 19 in a very short space of time. And that's when I went on maternity leave and I came back. And I'd been pushed into this quality role. And it was new. ICHE 6 wasn't around. As I say, we didn't have SOPs. So I felt at the time pushed into this quality role. As I say, somebody clearly understood me better than I did. It's a brand new group, brand new team. And I enjoyed it. So then when second child came along and I was pushed further into quality, actually I was happy with that decision. And I always say jokingly, as a failed medic, because I lost my place at Liverpool Medical School, I got into more the medical side of it, because when you're doing an investigator site audit, you're looking at people's medical records, you're looking at their medical history, you're seeing how they're treated, you're seeing the raw data from those adverse events. So you really get to understand what's going on in the hospital, how measurements are taken, how scans work, and so on. So I got close, and no regrets ever. I've absolutely accepted consequences of my actions and thoroughly enjoy life.
With quality, which is where you specialise, that's your subject matter
absolutely.
Expert right there. Where does it sit, again, for those who aren't aware, where does it sit in the life cycle of the industry?
It covers the whole life cycle, and quality is actually broken down into various sections. So there's work that's done in the lab, and that's not very restricted, but there still needs to be some guidance so that every time they measure a particular parameter within that early research, they do it the same way, and they write up their reports the same way. Then there's and that's even before GLP, that's research quality, if you like. Then there's the GLP, where we're doing the preclinical work, often on animals, not always, rats and mice. I've seen those. I've seen the pigs. One of the audits involved the pigs were being experimented on. It was a dermatology type study. So I got to play with our pigs, which was really quite fun. One of those beautiful moments during an audit. And then you get on to the manufacturing side, so how we manufacture the IMP.
Yeah.
There's obviously this equivalent within the medical device for the generation of that, not an area I'm so strong on. And then there is the quality assurance for the clinical trials as they're ongoing. And then, of course, there's all the post-marketing safety work. So as those adverse events that happen when the drug is being licensed around the world and given to all sorts of patients, as that comes in, that's another whole science. And again, there's a quality assurance aspect to that, along with computer systems that go through everything.
The beloved computer systems.
Oh, yes.
The necessity, the frustration of many people in the industry for that specific niche need.
Absolutely, yes.
You mentioned a few things there which I think we need to again rewind and have context to, because you speak about your introduction was obviously within clinical data.
Yes.
You've been very fortunate to have had a career that spans across pharma,
Yes.
bio,
Yes.
and CRO.
Absolutely.
Med device as well?
A tiny bit of it.
Let's put med device in there as well.
Okay, yep.
How have you achieved this? What's the secret? Because, there are so many skill sets which, a global company that has, for example, been able to finance the need for developing ATMPs, for example, cancer treatment.
Yeah.
And they want somebody who's got experience of big pharma, small biotech.
Absolutely.
CRO research,
Yes,
because you have an understanding of how each industry works specifically.
Yes.
How have you been able to craft a career where you've got experience in each of these different areas?
I think there's a bit of luck in the fact that I'm not driven by money. So I've been able to go into a role, and perhaps a new startup company hasn't got a lot of money, but I've been able to take the skill set I've got from big pharma and translate that into a small biotech and learn on the job. So an awful lot of luck in the way I worked. So after bio, which is obviously a big pharma, I then, as the children grew up, I worked part-time running my own company, doing bits of work all over the place, quite a lot of training, so consultancy in all shapes and forms, audit, training, CSV work. And a lot of those, I remember one client saying, "Can you go and audit sales and marketing for me?" And I looked at them and went, "What?" I said, "I've never done it." And to me, honesty is always top. I've never done it, but let me go away and see what I can do for you. And they were fine. Yeah, that's fine. That's okay. Just go and do it. I was very shocked at that response, but I've taken all of those and learnt from them and then moved on. It's the same as the first time somebody asked me to go and audit the translation company we were using. Where do you start? They just translate it, don't they? So then it's picking down the process and working out, well, how do we ensure the quality of a translation? How do we know that translation is correct? And so again, it's just breaking it down, thinking about it, and logically building up an audit from that.
So luck.
I think there's a lot of luck, or as you and I would say, led by the Lord, I'm sure. And so, I used to hate that question. What do you want to be doing in 5 years' time? I don't know. Depends where he sends me.
So luck, and obviously, I don't think it's a case of being in the right place at the right time. I was fortunate to be a part of a panel discussion about 3 weeks ago, and it wasn't a case of who you know, it's more a case of who knows you. And with that being the case, you talk about pharma, bio, CRO, and med device. I'll ask the exact same question in regards to how you got your GxP experience. Because I know you're skilled across clinical and manufacturing, and you've had distribution and laboratory experience. How did you gain these skill sets to become a GxP SME?
Usually somebody asking me to do something, can you go and do a lab audit? Well, I'm not skilled in that area. can I bring a consultant along with me to learn from them? So GLP, I learned from a consultant, and I went on a training course beforehand as well. In terms of CSV, 37 years ago, we were given a new computer system. And can you do something around validation, Heather? I was like, what does that mean? And nobody knew. Yeah. Nobody knew. So I sat down and I thought, well, I guess we've got to make sure it works as we expect it to work. So we hand wrote a few we ought to try entering some data and checking that these edit checks work and so on. And we did that. I'm not sure there was much documentation at that point. Definitely not what we'd have now. And again, learnt on the job.
With that same mantra of what you've experienced then, I'm assuming that, in the senior positions that you've had of being a director previously, being heads of previously, being a consultant working with, global farmers or organisations in general, that this same methodology would be what you impart into teams that you hire.
Absolutely, yes. Yes.
How do you look at skill sets, and bring an individual that might not, for example, have a manufacturing background into a space where it's predominantly GMP?
Yeah. So I will, if I've got the opportunity, and some companies do, allow me to test accuracy and logical thought processes, that will help to drive my process. I will look at the CV.
Yeah.
And there were times in industry when you'd have a pile of 50 or 100 CVs, and first typo, it would go straight on the no pile.
Yeah.
And then you reduce it down further. But the other thing I do is at interview, I will ask scenario-based questions.
Okay.
And one of my favourite ones is, and it's a situation that happened to me, I went off to do a vendor audit, and my travel plans were chaotic. I lost the first morning, so I lost 25% of my time to do that audit. Days pre-COVID, so we wouldn't have shared documents electronically. What are you going to do? That's the question I asked the interviewee. How are you going to then manage that audit? And the response that comes back is very telling of how that person thinks and works. Yeah. So it's all scenario based. I'm not going to share too many of my interview questions.
No, I'm thinking already what I would say. Would I pass the Heather Wells test? Okay.
And I have recruited some of my best employers didn't come from a pharma background. One gentleman was a nurseryman growing trees.
Really?
And he just had the ability and the aptitude and could answer my questions, could use his logical thought process to answer the questions I had. And he's gone miles. He's done really well. So
and he's progressed.
Oh, absolutely. Yes, within, I don't know, definitely within 5 years he was managing a team of data managers.
Really?
Yeah.
Had no background of life sciences?
No. I've had quite a few QMS administrators who are now quality managers, and they've had backgrounds of TAs, teaching assistants in school, HR administrator, I'm trying to think of some of them. Many of them have got nothing. And they just then embrace and enjoy learning, and they are amazing at their job. And again, it's that logical thought and attention to detail. It's always attention to detail that's important.
So, selfishly, should Stephen Fuller, right here in front of you, you know me from, I'm a musician. That's my background.
Yeah.
Jazz musician, trombonist, one of the UK's finest. Of course. Should I have wanted to transition into a position in quality, based on just paper, obviously knowing that I play the piano, trombone, would you be able to kind of pick out what area my skill set might be best suited to?
I would definitely look at you as a musician, because if you think about a piece of music, think of, for those that aren't musicians, a full stop. It has at least, it has two basic meanings within music, full stop is tiny. You have to see it, and you have to then play the music differently or longer, and so on. And I had 2 students who were both phenomenal musicians. One was a trombonist, actually. In fact, they both were trombonists and pianists.
UK's finest.
Of course. And their attention to detail was absolutely stunning. The 3rd student was going off to be a medical student, but he wasn't a musician. He had a reasonable level of attention to detail as an 18-year-old, but it was not on the same level as the 2 musicians. And if you think of a piece of music, the first thing I pick it up, what's my time signature, what's my key signature, how fast are we going to play this? And then, as we call it, the geography. So where have I got to do a repeat? Have I got to repeat to a sign? Well, where on earth's the sign? Follow all that through. And then you start to play the actual notes. And if it's going at speed, well, it's a lot to take in.
So some form of data deviation-y QMS area for musicians is where you would see the biggest skill sets in terms of being able to be translational.
Absolutely, and particularly if they have an interest in that area. Yes. Yeah, how many accidentals have we forgotten to play? There's your QI for you.
But, here's the thing. Many people would assume that if you're going to work in the life sciences industry, you need to have that degree. You need to have that master's, that PhD. So, it would take somebody who's very experimental, like yourself, and open to change, to be able to see somebody for who they are, think outside of the box, and obviously drive good results for an organisation in general.
Yeah.
Let's move on to you as a senior member of staff, a woman who's in senior leadership teams, heading up interactions with the board, MHRA, FDA, hosting inspections. What's that journey been like for you as a woman in the life sciences industry? I can only imagine that, when you started in the 90s?
Oh, 80s.
80s! Okay, you're younger.
Oh, 86, 86.
In the 80s then, when you started in the 80s, right up until current day, because I know you're still very active, you must have seen some things which have been appropriate and not appropriate.
Yes, I'm a very accepting person. Yes, there has been a lot of male behaviour that would not be tolerated these days. But I grew up in an era where you just accepted it and moved on. Obviously, if it went to a certain point, you would definitely have done something about it. Just ignored it and got on with life. I have vivid recollection of the first day we saw a lady from HR wearing trousers in the office. How dare she? And can we wear trousers in the office, please?
Wow.
So that's an early memory.
Yeah. And do you think that there is, generically speaking, do you think there is an issue of women in hierarchical positions who are being supported to the level where, there is full trust in what their vision and mission is within organisations and companies in this industry?
I think there are. There are also a few women who throw their weight around because they feel they are female and they need to stand their ground. I would much rather work with people, and to me, a human being is a human being, and I will work with them the best way. If and it doesn't matter whether it's a male or a female. If the wrong thing is done, I will respond to that. They may respond differently to it, but I've had aggressive, harassing behaviour from both men and women. So to me, I'm just, as I say, I accept human beings as they are, and I just treat as I find.
Excellent. What makes a good leader, Heather?
Knowing their requirements, clearly specifying what they want from somebody. Okay. I had a boss. He was quite a tough boss to work for, but we always knew where we stand. We always knew what he wanted. So if for some reason we hadn't achieved, we'd go and say, sorry, not quite manage this because, or you would give the piece of work or the information knowing full well that you'd met all his requirements. So that's, yes, and I think that's key in every scenario. If you don't know what your boss wants or your manager wants, how on earth can you achieve that? And of course, at my level now, I often get left just to do as I feel fit, but then I still need to know when I need to escalate something. And to me, that's fairly intuitive. And again, you're not always told when you should escalate something. You know, your manager doesn't want an email in their box every day because there's some trifling issue. If I can deal with it, I'll deal with it. And there are times when the email is straight to the boss. You need to be aware of this. I'm handling it, but you need to be aware of it. And that's all. And sometimes they come back and sometimes they leave me to it.
The thought process in terms of I'm catching on to what you just said there actually, but in terms of when things need to be escalated, I know you as a manager, I know you as a person. We've spoken previously about being non-judgmental in actions of management, in actions of how you approach the work that you do on a day-to-day basis. Let's take, for example, the idea of, you mentioned investigator site audits. And let's take, for example, your MHRA inspections. To many people, they're thinking, what's an inspection? To me, that is when an auditor comes in, they've got their A4 piece of paper, and they're going around ticking boxes or crossing boxes. Is that what it's like?
No, not really.
Okay.
So an inspection is when it's a regulatory authority.
Yep.
An audit is when it's anything else really. So if the MHRA come in, that is an inspection. Yes, they have a A4 pad with them, as I would, and there's prompts on there as to what I want to look at. So there won't be detail. There'll just be the fact that in this protocol, I know they're using a sphygmomanometer, they're using a balance or scales for the patient's weight, they're using an ECG machine, they need to use a centrifuge for the lab samples. So I'm looking for that equipment so that I can then go and check out the calibration of each of those pieces of equipment. So that's what's on my sheet. The MHRA, I have managed to have a little squidge at them from time to time, and there are certain questions on them. Interestingly, I had an MHRA inspection and we had a little bit of an issue. We resolved it, it was all resolved. The next inspection I hosted, they asked the direct question that we'd had at the last one, so they're clearly doing that process improvement, which is good to see, it's good to know. They're human beings again, and because my approach is always openness and honesty, I've never really had an issue with an inspector. I took over a company for maternity leave, and a couple of days later we got the letter from the MHRA. I'd already started to assess the SOPs and felt they could be improved. The MHRA inspector says, right, we'll look at the quality system now. And I went, to be honest, it's not fit for purpose. Ooh. She said, why? And I explained what I was doing and how I was doing it. Again, of course we got an inspection finding. The company didn't have an appropriate quality management system. But I wasn't going to sit there and let her dig to find what was wrong when I know it's wrong. And I worked with her on how we improved it. So that was a very good one.
That's interesting to hear, because obviously, you think of other sectors, whether it's education, for example, and how they have, inspections. Well, I've forgotten their name.
Oh, the educational ones.
Yeah.
They're gone.
What is it? I used to work in education. What's it called again?
Ofsted. That's the ones.
Ofsted inspectors would come in.
Yeah.
Immediately. School shut down. 2 days of planning, prepping, making sure all the paperwork is there. Appropriate for whatever.
Yeah.
Not once would you ever think that, for example, an English teacher who's meant to have had X amount of marking completed, take that to the inspector to say, we're not ready. Yeah. We're not fit for purpose actually for this find what you're about to look at. But in your industry, what you're saying to me is that's okay. Correct me if I'm wrong.
Well, no, because we should always work to be inspection ready. So generally we are.
But should obviously there be a situation where it's not ready?
That's right.
You can take it
yes,
to the inspectors and say, well, listen.
I would, yeah.
We're not ready right now. However, this is what we're planning on doing.
Yes.
This is this is what we've budgeted for in terms of bringing in more personnel to help with the data and things like that.
Yeah.
Is that the same process with the FDA as well when you're inspected by, or is it different?
I would wait for them to ask the questions. They do have a slightly different inspection style, but it's similar. I wouldn't sit there and bluff my way through something that was clearly not up to standard, just because that's the nature of me. And again, I make sure the team get everything so that we are inspection ready. For goodness sake, the inspector could walk through the door without any announcement. And if that's the case, I want to sit there, as I would say, I say to my team, as cool as a cucumber when they walk through the door, knowing everything's in order. And if it's not, I want to know what are going to be our findings before they arrive.
Okay.
Because you can't process improve them unless you know what your problems are.
To people listening, pharma, bio, CRO, where would you assume, thinking back to the start of your career, if you were Heather Wells, age 22, and you're starting a career again, where would you think in today's day and age you would enjoy most gratification from work in terms of pharma, bio, or CRO?
It's the people you work with every time, every job. The jobs I've enjoyed most are the people I work with. They might be the hardest jobs. And I think sometimes a CRO is a really hard job because, as I said before, my manager, I want to know what his requirements are. Each of my clients, I want to know what their requirements are. What are they hoping I'm going to deliver to them or my team? And so you've got lots of people that you need to please, lots of different requirements that you need to meet. So in a way that's hard. But in the CRO industry, both CROs I've worked for a period of time, they've just been such lovely, supportive team members, a real team effort, so we're supporting each other, we're helping each other. I can pick up the phone and say, help, I'm feeling a bit unsure about this. Can we just bounce ideas off each other? And so that is where, and I think it probably is because you've got all these clients with different requirements and you're trying to make sure that you meet each client's requirements so that you deliver what they want.
Okay. So I'm hearing, I'm not going to put words in your mouth, but I'm hearing that the CRO industry might potentially be a hard area to work in.
Yeah, I think it is.
Bio, obviously, it's the up and coming. Everybody wants to.
Fun.
Yeah. Why is it so much fun in bio?
Because usually you're building the whole quality system and you're putting all the processes in place. And it's a small team you're working with. So you've got new challenges to try and overcome.
And that's interesting because that's, as you said, and I can see on your face, you really do mean that it's fun, but also potentially in very high pressure environments.
Yes, I think that's probably where I've met the more difficult characters in my career.
Okay.
Yeah.
And then thinking about pharma.
Yeah.
What would you say about pharma?
It's sort of quite cosy in a way. You still work hard, don't get me wrong, but the processes are well defined. Staff are, happy and what have you. That they're still supportive in a team, but not in the same way as in a CRO. That's the sort of the middle ground, if you like, just sort of comfortable area. Yeah.
So depending upon where you are in your life and your career, you can find a place in any one of those three and enjoy.
Absolutely.
Or be frustrated. I've spent many years, and other people listening would have spent many years recruiting into pharma, recruiting specifically into bio, and CRO and medtech, and hearing your experience hands-on as somebody who's covered this is really interesting. Bringing it to an end, or this conversation to an end, you know, again, what advice would you give to yourself or anybody who's up and coming, starting in this very much needed and necessary industry?
If you've got the right skill set for quality, it's you get to travel the world, usually, and it is lovely. I would actually, I'm really pleased I started in big pharma.
Okay.
Because I had that really good grounding across, and then I could transfer all those skills to, I did some consultancy work in the middle, I did some CRO work, then I did some biotech. So the translation was quite good. I got a good solid grounding to know how big pharma works, to then use it within the CRO environment, and then to translate all that information and knowledge and know-how into small biotech to help them build their quality systems and grow. Yeah.
Excellent. Well, look, thank you, Heather, for everything in which you've divulged here today and given an insight as to a world of quality assurance across pharma, bio, and research. I look forward to seeing where your next steps will be. I kind of have a snapshot behind the scenes of where you're heading. But yeah, good luck. Thank you for coming to speak to us officially on our BioTalent Social platform. And, long may you have health and happiness.
Thank you.
Thank you for your service, for what you've done over the last few years.
Yes.
We're out.
Lovely. Thank you very much, Steve. Thank you.
Thank you once again, Heather, for all of your insights. BioTalent Social is part of BioTalent. We are a life sciences specialist recruitment agency who specialise in the full spectrum of life sciences from preclinical all the way to commercial. Reach out to find more on our website www.biotalent.com. Thank you for listening and stay tuned for our next episode.